Good afternoon, everyone. I'm Jain Abhay. I find myself a little bit out of place here because I'm actually a surgeon. I'm very much a West London surgeon around the corner for the last 15 years. So what am I doing here? So over the last few years, I've actually seen medicine not evolve like any other business. Medicine just became expensive, and globally it is the second largest spend. It's the second largest GDP spend globally. Trillions and trillions. So what is the problem? Every other industry is getting efficient, and medicine is only increasing the cost. So I was still ignoring it. I was very happily getting paid my huge fees. But then I started noticing something in the media that actually made me look at this very differently. And that was a negative perception about doctors. Everyone started talking that doctors are money-minded, they're only interested in sending people for tests, especially in India. Violence against doctors started becoming commonplace. So I actually started thinking, what is the issue? And the issue is actually very simple. Medicine is not different than any other industry. It is a data-driven decision-making industry. But the data gets lost at every point. You go to a GP, he sees you, acquires data, gives you a prescription, you go home, he's lost 70% of the data, you just have your prescription data with you. You give it to the pharmacy, you lose it very quickly. For the next episode, we restart the whole process. You might have some blood tests, and they'll get repeated over and over again. Is this problem only in India? No, it is global. So what is the answer? The answer is to connect healthcare. But then I was actually surrounded by big pieces of software, very expensive ones from American healthcare systems. I could log in, I could see a CT scan from wherever I was. The only problem was I never had it with me. I had to be either with the patient or in the hospital to be able to acquire the data. And secondly, my patient never had access to any of that. So we started with a vision, or rather I started with a vision rather foolishly 4 years ago, to create connected healthcare. After 3 years and a multiple figures down, I found my two idiots who actually saw the same thing as I did. And 12 months ago, we started Clinivantage Healthcare, which is nothing more than a connected healthcare platform which joins you right from the patient to the doctor, to the clinic, to the hospital, to the pharmacy, to the lab, to the provider, to the regulator, to the insurer. Now, is this possible? Of course it is possible. It is because data just has to smoothly and flawlessly flow across. Once we got the concept ready, we straight away had our first order and we deployed our first system 3 months ago. As we were developing this particular product, we were actually invited by the government to help us with population health, to say, listen, we don't have doctors in our rural areas, can you help? We went ahead and just integrate this very simple device that I have, which I've actually demonstrated with Arun. I can give you 6 parameters on this, which I can actually operate through my mobile, and the data will be visible to your care provider wherever in the world he is. Friends, that saves lives. You travel all along, we all go to exotic places in the world, but if I get a chest pain in the middle of the night while I'm in an exotic resort, I'm totally at the mercy of the doctor who is there, who has very limited data on me. I have tons of data which Google has, but my doctor has very little. And that lack of data can potentially make a wrong decision, and it can make me lose my life. So we decided to integrate this very simple device as a personal health device. And now you actually can carry it with you. You can talk with your doctor. The doctor can look at your vital parameters. He can give you advice, and if necessary, he can actually see the next level of help available there from a medic to medic. So this is what Clinivantage was. We then went on and created a patient app. We said that if we are going to empower our patients, let's empower both the doctor and the patient. My entire ecosystem is actually available as an app for the doctor and as an app for the patient, whereby his entire clinical history throughout his life is available for him, for wherever he is, and same for the clinician. The patient has the choice of assigning which clinician has access to his data and who doesn't. So if you go to a new doctor, you don't have to carry anything with you, just assign him to your care team, and the data will be visible to him. We were recently signed up with the state of Maharashtra. I started with an ambition of 1 million people. I already have 3 million people signed up. We were initially planning a revenue of £2 million by the end of 2018. We are already booked with a projected revenue of £12 million by the end of 2019. This is my device, which I'll be happy to demonstrate. So we look very complex out here, but the idea is very simple. The idea is to empower people with the information that they need at all points. You do not go for an operation without the information of what that surgery does to you, what your risk is. We were recently awarded by the Modi government as the Champions of Change, and we are working with the government of Maharashtra for improving public health. What am I looking for? I'm looking for people to help me build this ecosystem together, geographical partners, joint venture partners to build new devices, to make this an enterprise worth doing. Thank you.
Okay, thank you, Abhay. Any